Thank you. And thanks, Senior, for asking me to participate. Uh, while trying to determine these properties and leverage points in dealing with all the challenges that we face, one thing we have to consider, which in a way is kind of a precursor, is maintaining our own equilibrium, not to say our sanity in the face of all these challenges. And if there were a simple solution to this, I think word probably would have gotten around by now. Uh, so, what is a key property that for each of us that sustains us in the face of such challenges? One thing that can help, certainly help me, is reminding ourselves of what we bring to the world. That is, doing what we were meant to do. I'm a retired physician. Being a good physician is one of the things that I think I was meant to do. And I want to give you two perspectives, two stories, both true, by the way. Um, First, as a doctor, and then as a caregiver. I was staffing at my endocrinology clinic where the way things work is trainees go in and talk to the patient after they presented it to me. And one day I came in, and one of my favorite patients had come in. This was a fellow who, while in the Army, his helicopter had been shot down. He called it rotor dysfunction. Uh, and he was comatose for a couple of days. Uh, Managed to do okay and continued in the Army for a total of 20 years and getting shot down another three times. Well, some years before this time, he'd come to me with a problem, and he somehow ended up in my clinic where I diagnosed a fairly unusual condition, which I'd never seen before, but in which treatment made a huge difference in his life. He's convinced still that I saved his life. I felt good about it, making this diagnosis and being able to treat him. But, the fact of the matter is I was just doing my job, which is fine. Uh, well, I walked into the room this day and said hello. Hi, Dave, he said. He always called me by my first name. Uh, he looked at the trainee. Then, while pointing at me, he said, "He's my hero." Now, this guy had been in the Army for 20 years, shot down four times, wounded. I was working at a VA medical center. Uh, I've never been in the military, yet he calls me his hero. Uh, I knew that being a doctor was what I was meant to do. Now, let me tell you another story. My wife had had a stroke. She was doing fine, and I was on my way to visit her at a hospital when I get a call. My wife had had a seizure. She'd had a respiratory arrest. She'd been resuscitated, but they were going to send her by helicopter to the neurointensive care unit at the main campus of the Cleveland Clinic, or as we are wont to say, the world famous Cleveland Clinic. Uh, so I managed to turn around. I get to the clinic. I walk into the main hall, which is huge and has all kinds of. Uh, I had not a clue care unit was, and of course, being a man, I was very reluctant to ask for directions. Um, and then somebody I knew, uh, doctor at the clinic that I knew, turned out to be the only neurologist at the clinic that I knew. And I looked at her, she looked at me, we recognized each other, locked eyes, and suddenly I felt this enormous relief that things were going to be okay. And she comes up to me and says, "Hi, Dave. I've heard about your wife. Let me take you. I'll be part of the team taking care of her. Let me bring you up to the intensive care unit."
30
Uh,
seconds.
on reflection, I knew that what I felt, what my patient had felt, and knew for certain I was doing what I was meant to do. Uh, I know how I feel when I tell these stories. I know how I feel when I hear others tell such stories. And it's that feeling that helps keep me going. I'm now a full-time caregiver for my wife, which during the past 4 years has presented me challenges. But even though I'm doing a very different job, I know I'm doing exactly what I was meant to do.